A blessed day, dear classmates, and welcome to our next lesson. So this will be a discussion on chapter number 5. So chapter number 5 is Epidemiological Environment, and this is still connected to the last or to the previous discussions or the previous lessons that we have discussed. So from environmental protection law, from environmental challenges, now we do have also what we call epidemiological environment. Now this is actually a very good lesson because it is in line or related to what is happening during this time, or in the concepts can be related in this during this pandemic. So later on also we're going to present to you what is the or how we understand what is all about pandemic, epidemic, endemic, and other kinds of terms that is in line to epidemiology. Okay, so we do have epidemiological environment, and so let me just proceed now on the next slide. So now let's check. Let me just check whatever your prior knowledge or there are something that you know about public health practices. So in this slide, my dear classmate, I just want you to choose among the 4 choices. So all of the following illustrate the purposes or purpose of epidemiology in public health practices, except one of the following choices. So I want you to choose only one, and then put your answer there in the chat section or in the comment section or chat box of our GMeet conference. So you have there letter A, identifying populations who are at risk for certain diseases. Letter B, assessing the effectiveness of interventions. Letter C, providing treatment for patients in clinical settings. Letter D, determining the importance of causes of illness. Please put your answer there in the chat section or in the comment section. Okay, so you have there some of you answered letter A, some of you answered letter B, and some of you answered letter D, but most of you I think answered letter B. So thank you very much, my dear classmate, on that response or answers. So later on, let us verify which one is actually which is not actually the purpose of epidemiology in public. My dear classmate, what are the things that you need to understand, or what are the things that I'm going to present to you in this chapter? I'm going to discuss to you what is all about epidemiology. So an introduction to epidemiology. We're going to define what is in epidemiology. What else? Epidemic, and then pandemic, and other terms that is in line to epidemiology. And then I'm going to present also to you determinants, classes, and categories of diseases. Let's start with this epidemiological environment. So when we talk about epidemiological environment, my dear classmate, we do have this kind of environment, or if you try to look at around us, it is actually described as epidemiological environment because, practically speaking, my dear classmate, we do have a lot of diseases or illnesses that is present within our environment, or even in a specific community, or within our own community. Okay, so there are also a way to solve or to respond or to understand now these health problems or health diseases or illnesses, and we do have what we call a public health approach. So how they do how they do that one? There are 4 different steps or ways in a public health approach. So first, we do have what we call a surveillance, or we're going to do surveillance. So what is the problem? What is the type of health problem, or what is the type of illness, etc. And later on, we're going to have a risk factor identification. So what is now the cause of this health problem? What is now the cause of this illness? What is now the cause of this type of virus, or the outbreak of this virus, etc. And afterwards, we're going to have an intervention and then evaluation. Okay, so what works now with this particular health problem, or what works now in this particular diseases, and so on. And afterwards, if we collect also, if we done already with intervention and evaluation, and we collected a lot of data, then that's the time that we're going to have implementation. So how do you do it? How do we going to implement now, or how we're going to solve now this particular health problem? Okay, so from a problem, knowing what is the problem, until going to a response. Okay, so that is actually a general way of what we call understanding or responding in particular, or approaching into a particular health problem, or health illness, or maybe other kinds of of illnesses. Okay? And now, my dear classmate, when you talk about epidemiology, so we always mention what is epidemiology. In a simple definition, when you talk about epidemiology, it is the study. The study and understanding about health problems and how to control these health problems. Okay? In a broader definition, it is defined as the study of the distribution and determinants of health-related states among specified population and the application of that study to the control of health problems. Okay, so basically, we are talking about health problems and the ways also that we're going to control these particular health problems. Okay, that is why epidemiology is actually a very important topic, no? And this is very useful not only for medicine students but as well as for the other courses or even for every individuals, no? So understanding what is a health problem is a very big impact within our society. Okay? So now, my dear classmate, when we talk about epidemiology, let us relate this now to what we call the public health practices. Now, so for us to apply the concept of epidemiology, we need to understand also the purposes, no, in public health practice. So you answered one of the choices a while back, no, either A, B, C, or D. So let us verify now, my dear classmate, if your answer is actually correct. So the first purpose you have there, discover the agent, the host, and environmental factors that affect health. Okay, so that is the first purpose, no. So for us to discover if there will be an agent, no, or a host of this particular health problem, or there will be an impact of the environment within our or with our health. Okay, but basically speaking, or practically speaking, there are impact of environment for our health. Okay, and aside from that one, determine the relative importance of causes of illness, disability, and death. That is in line, no, to the first bullet. So we are also one of the purpose of public health practice is to determine, no, yung mga relative importance of causes of this illness. So what caused now this illness, what caused now this disability, and what caused now the death of this individual. Okay, and we also have to identify, no, one of the purpose to identify those segments of the population that have the greatest risk from a specific cause of ill health, or let's say a health problem. Okay, so we're going to identify also a particular population, or maybe in that particular population, what are the different risks that is being or that causing now, no, this particular health problem. Okay, so let's say for example in a particular community, let's say low minority community or low income minority community, will probably having a different different risk, no, from a specific type of causes now to this health problem. Look at what is happening nowadays, no, when you talk about pandemic. No, so there are also risks, no, from specific causes of this particular COVID-19. Okay? And the last one is to evaluate the effectiveness of health programs and services in improving population health. So basically, we are having public health practice. At the same time, we also evaluate, no, or assess if the different programs and services that is being provided to us is effective. So that is also a good thing for every health institutions, or let's say for a clinic or health centers. They are evaluating or they're assessing their programs and services that is being provided to the people. Okay, so that there will be a good or let's say effective type of curing or preventing particular health problem. Okay, so those are the different purposes in public health practice. So your answer is either A, B, C, and D. Your answer should be letter C. So we don't, it is not actually the purpose of public health practice providing a cure, no, to patient in a clinical setting. Okay, so we are more onto those different purposes. All right, my dear classmate, I presented to you earlier, no, the public health approach. Now, aside from that one, we also have another way, no, to solve now health problem. This is similar to the public health approach that I presented to you earlier. But let us look at some of the different details or different terms that they use. No, so solving health problems. First step, we have there data collection. So still, we're going to start with surveillance. No, we're going to determine the time, the place, and maybe person that is was that connected or related to that particular health problem. Now, what else? If we gathered now data regarding those, or we do conduct already surveillance, then we can proceed now to step number 2. So assessment and inference. Now we're going to assess now this particular data that we collected, and we're going to evaluate. We're going to check also the different causes of these particular health problems and so on. Okay, and after that one, we're going to proceed now to step number 3, which is hypothesis testing. We're going to determine how and why. So how and why there is this particular illness or this particular disease, no? Or maybe determine how to cure or how to solve this particular health problem. Okay? And if we do have already this hypothesis testing, that's the time that we're going to proceed now to step number 4. So action or intervention. So if we know already how to deal with this particular health problem, then our next step will be more on implementation as well. Okay, so how we going to implement now this one, how we're going to intervene now in this particular person or this particular population to solve now this particular health problem. Okay, so 4 different steps in solving the health problem. It's a little bit, if you're going to look at it, it's very simple, no? Simple structure of or simple steps or procedure on solving a health problem, but it is actually very complicated, no? It takes a lot of effort and time to solve a health problem. Yan. So no wonder why the COVID-19 virus is until now, no, even though we do have vaccines already, it takes still a lot of time to solve this particular COVID-19 virus. Okay, my dear classmate, we're going to talk about epidemiology. Yan. So again, there are important key terms, no, that we need to take note. So I have mentioned to you earlier that we're going to discuss to you or differentiate the different key terms. Let's say, for example, pandemic, epidemic, endemic. Okay, so let's start with the word epidemic. And epidemic is also known as outbreak. No, so it is defined as the disease occurrence among a population that is in excess of what is expected in a given time and place. So let us use COVID-19 as an example. No? So let's say, for example, during the early time or the starting of COVID-19, no? So it's not yet spreading around the world or around the globe. Let us try to look at only Wuhan city, no, of China. So when you talk about the epidemic, and the COVID-19 is considered to be an outbreak or epidemic if we are only talking about Wuhan city. Yes, because that is the origin, no, or we're in the outbreak of that particular COVID-19 virus. Okay, so if we are only talking about Wuhan city, that is in line to COVID-19. COVID-19 there is actually epidemic or an outbreak. Okay, so what is expected in a given time in place? So we are talking only on the Wuhan city. Okay, and so what if, no? What if this COVID-19 is already existing? Yeah, it's already existing, and it's been present for the long time or at all times, no, in this particular city. Let's say, for example, again, Wuhan city. No, let's say COVID-19 is already present in this Wuhan city of China. Then that's the time that we can say that this COVID-19 is actually an endemic. Why endemic? Because when you define endemic, endemic is a disease or condition present among a population at all times. At all times, meaning, let's say, for example, COVID-19, no, is already present in this city, and at all times, or let's say in that particular population of the city is already present, no, let's say for a very long time, then that is what we call endemic. Okay? And if this type of virus, let's say COVID-19 virus or a disease, now we're going to spread out now among the regions or outside the city, and outside that particular city, and going to spread in the different regions at the same time at different countries. Okay? That's the time that we can call this COVID-19 as pandemic. Okay? That's why it turned out to from epidemic or from outbreak in Wuhan city, it turned out to become pandemic. Okay? So that is why we call it as a pandemic during this time. So when you define pandemic, it is a disease or condition that spreads across regions. So take note, no, COVID-19 spreads already around the globe. That is why it is called a pandemic. Yeah, so those are the three different terms that sometimes people are confused. No, what is the meaning of epidemic? What is the meaning of endemic or pandemic? Sometimes also they use the same terms, no, and they have the same definition. Okay? And that is why we are presenting to you these different terms. Okay? And aside from that one, in line to epidemiology, there is what we call cluster. No, and aside from using group, or instead of using, I should say, instead of using group of cases, and they are using actually the word cluster. Yeah, so cluster is defined as a group of cases in a specific time and place that might be more than expected. Okay? Aside from cluster, we also have the term rate. So instead of using number of cases, we are using the term rate. Okay? So rate of COVID-19, rate of let's say hypertension. Those are number of cases occurring during a specific period, or this is always dependent also on the size of population during that particular period. Okay, so those are a bit more or in line to epidemiology, no, yung term na cluster and then yung term na rate. Okay, so what is important, you know the different terms, which is the epidemic, endemic, and then pandemic. Okay, so that is the important epidemiology key terms. Alright, now let me just check your knowledge, or let me just present to you practical examples, no, so that you will identify or differentiate or understand more about these three different terms, which is pandemic, epidemic, and endemic. So first one, and we do have this malaria. Malaria is present in Africa at all times because of the presence of infected mosquitoes. Malaria is blank in Africa. So I want you to answer, no, either pandemic, endemic, or epidemic. So malaria is blank in Africa. What is that one, my dear classmate? So put your answer there in the chat section. It is actually it is endemic. Okay, so very good. It's actually a endemic. So malaria is an endemic in Africa. And even here in the Philippines, if we're going to change that sentence, no? So let's say, for example, malaria is present in the Philippines at all times because of the presence of infected mosquitoes. Then malaria is endemic here in the Philippines. Hey, another example with your classmate. The Ebola virus in parts of Africa is in excess of what is expected for this region. This virus is a blank or unblank. So what is your answer? It is a epidemic. Okay, very good. So it's actually epidemic. And then the last one, HIV or AIDS is one of the worst global disease in history. It is a or on. Your last choice will be, or your last answer is pandemic. Okay, very good. So thank you very much, my dear classmate, on that answer or responses. So HIV or AIDS is considered to be a pandemic because it is described as the worst global disease in history. Okay, and until now it is present, no? And even COVID-19, COVID-19 virus is an example of a pandemic. So that is how you differentiate now, my dear classmate, what is endemic, epidemic, and we also have the pandemic. Alright, now, since we are talking already the different, since we talk about COVID-19 and also we mentioned other type of diseases or illnesses, there are determinants, no? Determinants of these health problems. So, why is it that we have this kind of health problems, or how does occur, or what causes now? What causes now these health problems? Because of these determinants, or because of those factors. So let's start with the green circle, my dear classmate. If you look at the green circle, we do have there the man, no? So we have heredity, sex, age, and then behavior. So for example, for heredity, there are health problems or health illnesses that can be passed on to generation, or to pass on to the children. Now, let's say, for example, I think we have what we call the arthritis, no? That is also being passed. What else? Hypertension can be passed on to also to children, no? And other kinds of diseases or illnesses. Aside from heredity, when you talk about sex, male or female, there are also certain types of illnesses or diseases that is more prone to males or maybe prone to females. Let's say, for example, HIV, HIV or AIDS. it is more on males yan, compared to females. So that is why, again, the sex is a factor, no, what causes now the health problem. Okay, another one, age. Let us look at COVID-19, no, my dear classmate. Isn't it that it is reported that most of the individuals that is being affected or vulnerable to this particular virus are the seniors and or the senior citizens, and that is still another example when we talk about this age. Okay, and then behavior. Yes, definitely. If we have a health problem, we act in a different way or we behave in a different way. Okay, so example, my dear classmate, if you have headache or let's say fever, you are having a different behavior. And that is the reality, and that is actually that can be observed, no, even in our personal lives. Okay? Or if you try to look at also what is happening to our classmates or maybe to our friends, etc. And if they have health problem and a simple health problem, their behavior is actually changing. Okay? And that is the different factor in line to man, or let's say in line to humans. And aside from those factors, and we also have general factors or determinants, no, on health problem. We have what we call the physical environment, geography. Yeah. We have their air, the altitude and temperature. What else? Water supplies and food supplies. So let's say, for example, temperatures, no. Let's say you stayed in a cold area and then suddenly you transferred to a hotter area. Definitely there will be a reaction of our body, no, or the body of that particular human or individual, no. So it may cause now reaction to the body, and it will also lead to a health problem, or worst case, maybe they're going to die because of this not going to adapt now in the environment. Okay, water supplies and food supplies. If there will be shortages, no, of these particular supplies, then it will lead also to health problems. Example, hunger. When we talk about hunger, if there will be a shortage of food, then definitely people are going to get sick. And aside from physical environment, geography, we also have what we call biological environment. Yan, the flora or fauna, reservoir of infection, vectors or viruses, and we also have microbes and bacteria. So biological environment, from the word bio, no, so life. This is more on internal type of internal factors, no. In, say, for example, in human body, we have also viruses and we also have bacteria. And one of the examples that is the example of disease, no, that we can accommodate or in line to biological environment. Example, we have measles, and chickenpox, and those things are examples, no, in line to this biological environment. And we have also the social environment. Social environment, we have economic, because of economic condition, because of education, because of occupation and income, the culture, the family, the community, social security, medical and health care, and then the government will also have an impact or considered to be a determinant for health problem. Let's say, for example, when we talk about economic condition, now let's say we have a bad economic condition here in the Philippines, then we can see that there is a big impact within our society in terms of health problems, because people are having trouble or with the economic condition, no? So example, COVID-19, now there is a big impact already of the economic system here in our country. Now at the same time, it is also affecting now our health problem. Education, my dear classmate, education. It is good that you are in school. Now you are being educated, we are being informed, we are being aware about these health problems. What else? Through education, we know or we understand the different kinds of diseases or illnesses or health problems. What are the ways also that we can do to counter or to respond these particular health problems, and etc. The good thing nowadays, we do have the internet, now, or the internet or the Google. So whatever information that you needed for health problem, you can already type or search in the Google. Okay, and we can watch also a lot of videos or tutorial videos that how to cure or how to prevent this particular health problem, etc. And practically speaking, my dear classmate, what we call humans are, or yes, humans or some people are getting more independent already. and at the same time dependent on the Google, or depending on the internet, or maybe in the social medias, if they are having a health problem. Okay? Especially during this time, no, that we have the COVID-19, it's really hard to go to the hospital, and the good thing we do have the internet. But then there are consequences, no. Instead of for some cases, and instead of curing or preventing your health problem, sometimes there are people that will, if they did not follow carefully the instruction, or they didn't really know what they are doing, or they are only depending on social media or in the internet or in the Google, sometimes instead of curing, it will turn out to become worse, no. So they will not going to cure or prevent this particular health problem that they are experiencing. Okay, so these are the different determinants of a health problem. So physical environment, geography, biological environment, social environment, and even the man itself, no? So we have heredity, sex, age, and then behavior. Okay, and aside from determinants, my dear classmates, when we talk about epidemiology, we need to understand also that there are classes. No, there are classes of diseases. So we have five classes of diseases. I don't need you to memorize those different diseases. No, I just want you to know that there are 5 classes. So for example, and we have the first one, infectious diseases. Example, diseases coming from bacteria, or causing from bacteria, protozoa, worms, fungi, and then viruses. Example, we have the measles and the chickenpox. That is an example of infectious disease. We also have pollution disease, or diseases. We have the emphysema, pneumonia, bronchitis, lung cancer, and we also have the liver cancer. So practically, or if you try to look at these diseases, it is actually more on air pollution, no? Or what causes now this diseases is coming from polluted air. Yan, yung bronchitis, yung pneumonia, etc. And we also have stress diseases, and stress diseases, food poisoning, red tide, hepatitis stages A to D. And we also have allergies, yan, superficial and deep mycosis, and also dandruff is considered to be allergies. And we know, no, I think all of us, or maybe if not all of us, most of us, no, is also having an allergy. Yan. And we also have the developmental anomalies, or also known as the teratologies. Yan. So we have the STD, or the sexual transmitted disease, and one example is the AIDS or the HIV. Okay, so there are 5 classes of diseases, and these classes of diseases, or these diseases or illnesses, can be categorized still into 3 different categories. We have 2-factor category of disease, and that will include only a pathogen and a man. Okay, so what are some example of for diseases? We have the influenza, acute coryza, and then pneumonia. Okay, so let us look at the the common, no, which is pneumonia. And not only pneumonia, what else? So we have also bronchitis and etc. And we also have the 3-factor category of disease. So it includes now pathogen, the vector or virus, and the man. No? So we have there malaria, H fever, yellow fever. And so H fever, that is not high fever, that is actually a hemorrhagic fever. Okay? And then yellow fever, because of the effect of the fever, no, it turns out that our skin is getting yellowish. And even our eyes is getting yellowish. Yung white part is getting yellow color. That is why they call it a yellow fever. And we also have malaria. And H fever, sometimes they compare this one with dengue fever. Okay? And these are some examples of 3-factor category of disease. And we also have a 4-factor category of diseases. So we have there the host. And includes now the host, the vector, the bacteria, and the man. So we have their virus, bacteria, and so on. So example, you have the plague, typhus, and then we also have the Q fever. Typhus is a disease or illness, no, from a bacteria. Yeah, same as true with Q fever, and a virus, or coming from a particular virus and then bacteria. They have scientific names, but never mind. No, I'll just give you a common type of example when we talk about 4-factor. You can include there the HIV, And you can also include there the AIDS. What else? COVID-19 virus is considered to be a 4-factor because there is a host, there is a vector, and there is a bacteria and the man itself. Okay, so what is important, my dear classmate, you know that there are 3 different categories of diseases. So 2-factor, 3-factor, and then 4-factor. Alright, so before you ask questions or clarifications, let me just give you the importance of this particular lesson or this topic. It is also good for us to be informed or be aware on the different concept in line to epidemiology, especially the determinants and even the other concept presented to you earlier, because we know what we're going to do. What if we are experiencing this particular health problem? What causes now this type of disease or illness that I am experiencing? At least you have a background or knowledge regarding this particular health problem. Okay? And that's a good thing. And it's also good to share to our friends or to our classmates. And later on, as we go on to these different chapters in our subject, we're going to discuss more in line to epidemiology. So because of air pollution or because of water pollution, there are also health risks or health problems that we are encountering. Okay, so that's it, my dear classmate. Do you have any questions or clarifications with our topic or discussion today? And if you do have questions or clarifications, then you can put there in our comment section or comment box, or you can use your microphone. And if you don't want to, you can also post anytime in our group chat. Okay, so thank you very much, my dear classmate, for attending our GMIT conference today. But before that one, please have a reading assignment. Please read about ecosystem, particularly to biogeochemical cycles, and that will be our discussion for the next meeting. Thank you very much, my dear classmate. Enjoy the rest of the day, enjoy your next classes, and I'll see you all in the next chapter or the next discussion. Take care always, and God bless.